Okay, so we have a patient that comes into the clinic. It's a basketball player, and they have actually had a partial tearing of their medial meniscus. And this patient injured themselves by planting and pivoting while they were on the court playing basketball. So now we're going to have a rehab program in order to assist them in getting back to play. Okay, so this is a HOPS eval for a partial tear of the medial meniscus. So the first thing you would do is you would go through your history, so you'd ask 2 questions. So my first question would be, did you hear a pop during the point of injury?
Yes, I heard a pop.
Okay, so if you hear a pop, that's one way you can narrow down that it's possibly still a meniscal injury. Another question you could ask them is where the pain is at. So if you want to show me where your pain's at. Okay, so he's feeling pain right along the joint line, and that's somewhere where you would feel pain if you had a meniscal injury, so that makes it still a possibility.
So in this video, you can see that the patient has trouble weight bearing on his injured leg. This is a common sign for a medial meniscus injury. The patient also has swelling around the injury at his joint line, but has no bruising, both of which are common signs for a medial meniscus injury.
So when palpating, you're going to want to palpate around the area that's hurting, and this will be the joint line in this case. So you'll just palpate around, and that should result in a positive test. And some other places that will result in a negative test would be the tibial tuberosity and the patella.
Okay, so one of the special tests you're performed to see if it is a partial medial meniscal tear is the applique compression test. So first you'll have your patient lie prone down on the table, and you'll lift up their leg to a 90-degree angle. You'll then apply pressure to the bottom of their heel, which will create pressure on their femur, in between the femur and the tibia, and you'll just rotate. And they will feel pain when you do this, especially on the medial side, which shows that it is a medial tear.
Okay, so another special test that you could do is the McMurray test. You'll have the patient laying supine, and you will have one hand on their ankle and one on the joint line, and you are going to externally rotate the tibia and apply valgus pressure, so going towards their midline, and just have them extend their leg, and that should be positive for pressure. Okay, and then you would perform a variety of other special tests just to rule out other injuries. So like the bump test would rule out a fracture, and you would just bump their heel to send shockwaves up the leg. Okay, so part of the treatment of the injury is going to be PRICE, which stands for protection, rest, ice, compression, and elevation. For the protection, we talked about the fact that you ideally want the patient not weight-bearing, so you would put them on crutches, ideally. You could also pair that with a neoprene brace for protection as well. That would prevent the rotation that's causing pain. Rest, 6 weeks, and then they can return to play just based on pain and when they have full range of motion and everything that they could do before. For ice, we chose an ice bag just on the knee as the best way to ice it. And you want to do about 20 minutes on, 20 minutes off for the first about 3 days. The compression would also come from the neoprene brace, so that's kind of a win-win with that. And then elevation, we just said you would elevate it at night and any time that you might not be on your feet. And
hey Zach, what are you doing?
Okay, so we're talking about now the rehabilitative phase of the rehab program. So that would be the phase 1. That's where it's like the first 1 to 3 days of treatment. So you really don't want them doing anything isotonic. They'll be doing a lot of isometric exercises. So one of the things that you'll want to work on is strengthening. So we would be doing a quad set. So you'd have the patient laying on a table, and they would just contract their muscles and hold that for maybe about 10 seconds, and they could do that a couple times. And that could just work on strengthening their knee again. Okay, so another exercise you could do during the first phase of the rehabilitation program is you can actually just do weight transfers. So you can shift weight in between the 2 muscles, and obviously pain will be your guide because it just depends on how much pain they're feeling, how much swelling they have. But they can just start to slowly add weight to the leg, and this can help them practice their balance and proprioception.
Okay, so then phase 2 is the next 3 to 5 days of the rehab, and some of those exercises could be like light biking to improve on the patient's cardio and keep that. And then we about squats. You obviously want to use the patient's pain as your guide. If they can't do a full squat, then you can do a modified squat, maybe with a table, and just have them bend down just a little bit and back up.
All right, in these final exercises, we have the patient shooting a free throw. This allows for range of motion and a little bit of strength specific to their individual sport. Along with that, we'll have the patient do some pivoting exercises to work on that twisting motion that commonly can cause a meniscal injury. This will get the patient more comfortable with making those motions, so that way when they get back into an actual game, they won't have any limitations or restrictions.
They can